Hi, everybody. Welcome to today's episode of the Fellows Forum podcast. Today, we have another episode of our Fellow of the Month series, and our Fellow of the Month for November is Dr. Nida Khan. Dr. Khan, thank you so much for coming on today.
Thank you. Thanks for having me.
To start off, would you like to introduce yourself and share a little bit about yourself?
Yeah, definitely. So I am currently a second year PGY2 Medical Oncology and Palliative Care Fellow at The Ohio State University in Columbus, Ohio. Um, I have always loved kind of oncology as well as palliative care. So really grateful to be able to do kind of both of those while here in Columbus. I grew up on the East Coast in New York. Did a lot of, if most of my training there actually on the East Coast before moving to the Midwest. And kind of in my free time, I like spending time with family and friends.
Awesome. Would you like to tell us a little bit about your journey in medicine and why you decided to become a physician?
Yeah, definitely, for sure. I'd love to. So I think my journey in medicine was kind of like a long time coming. I did have a little bit of a non-traditional path. When I went to college over in New York City. And at that time, medicine wasn't really on my mind. I actually was an anthropology major and I wanted to do diplomacy and international affairs and things like that. So after I graduated college, I actually worked at the UN for a couple years doing some of NGO work, which I loved, super rewarding. And then kind of towards the end of my time there, decided that I wanted to do a career shift and decided to switch to medicine. A lot of that was inspired by a lot of the women's health work I did during my NGO work. And I kind of used that as a driving force to kind of get involved in medicine and apply to med school. I then went to med school at Temple University in Philadelphia, Pennsylvania, completed med school there, and then came back to New York for my internal medicine residency. Um, and then, and now I'm here in my medical oncology and palliative care fellowship in Columbus.
That's really amazing to hear about. I know a lot of the experiences you've had probably contributed to pursuing a palliative care fellowship. Tell us a little bit more about why you decided to pursue this journey?
Yeah, definitely. I'd love to. So, yeah, you're right. A lot of like kind of my experiences just in my prior work and just through a lot of the patient exposure rotations I had in med school and internal medicine residency really informed my decision to do both medical oncology and palliative care, I would say. I think my love really started in med school. I had a lot of just kind of serendipitously, I think a lot of my rotations ended up being at the cancer center that was attached to Temple in Philadelphia. And really just having the ability to work with that patient population who had really every type of, solid cancer or malignant heme cancer. And then also at the same time, seeing that a lot of these folks had long-term morbidities that required a lot of supportive care, a lot of symptom management, and then really just in general, a lot of advanced care planning and goals of care discussion. So both of those together combined, I think really informed my decision to want to do both medical oncology and palliative care. And then this was just really reinforced throughout my residency experience.
That's amazing. Going into this a little bit more, what are some of your areas of interest and research areas you focused on?
Yeah. That's a great question. I'm interested definitely more in the solid onc sphere and then also in the supportive oncology sphere too. So right now my focus is mainly in thoracic and head and neck cancers, and then both of those cancers have high morbidity, especially head and neck. A lot of kind of long-term morbidities that these folks deal with. So from the palliative side, I'm really interested in kind of focusing on symptom management for these patients. A lot of cancer related pain, a lot of these folks, especially head and neck folks, are going to go through really intense radiation regimens that end up with xerostomia, dermatitis, all these kind of long-term morbidity effects that I really like to look at. More research wise, I think more kind of health systems research I'm pretty interested in, and have been looking at how palliative care referrals in our cancer center work, also looking at how we can better deliver palliative care to our cancer patients.
Great. These are all such important research spaces. So what are you planning to pursue after your fellowship?
I'd like to have an opportunity to combine both medical oncology and palliative care, really maintain both skill sets. I definitely love the academic world and the collegiality of that, so I'm looking to hopefully stay in that, and then um, work in some type of head and neck or thoracic onc sphere, while also having the opportunity to deliver palliative care and symptom management to cancer patients. Overall, and that's kind of like my hope going forward.
Awesome. So as we wrap up, the one question we ask everybody at the end of these interviews is, what is your favorite part of being a fellow?
It's a great question, and it's hard to pick one. I think I'd say fellowship is definitely a huge learning curve, but then also having the ability to really embrace that has been really great. Having the collegiality and all the folks, your co-fellows, your attendings, your PDs, everyone just super collegial and willing to learn and getting to know everyone. I think that's probably been the best. And then of course, really having the opportunity to develop relationships with patients and really kind of also hone your craft that you're going to be doing for many, many years moving forward. So I would say that.
Definitely. Well, it's been great to hear about your fellowship experience today. It's also been great to work with you the last couple of years or so and hear all about your research and interests. We look forward to doing more. So thank you so much for coming on today to tell us all about this.
Thank you. Thanks for having me.